For those of you who are joining us for the first time or are new to the Tech Council, the San Francisco Tech Council is a multi-sector initiative, and we build government, business, nonprofit, and consumer collaboration to advance digital inclusion for seniors and adults with disabilities in San Francisco so all can participate in the city's connected community. So that brings us to today's agenda, the focus on racial equity. And this is the first in a series of meetings that we'll be hosting to apply an equity-driven framework to advance digital inclusion in San Francisco, especially focusing on communities of color and widening disparities in light of the COVID pandemic. We'll have Winnie Yu, who is Director of Programs and Administration at Self-Help for the Elderly, and she will share some of the issues and challenges that her organization has identified, as well as feedback it has received from clients participating in their virtual classes. And the issues and challenges will address both some of the general technology factors faced by seniors during COVID, as well as issues older workers have faced in the employment area.
Hi, good afternoon, everyone. Thank you very much, Andrew, for the opportunity and for Carla to speak at the SF Tech Council meeting today. I'm sorry, I'm wearing a mask because it's what we need to do at work. We have staggered work schedules, and so this is part of staying safe in the workplace. It's been a whole new world, I think, for all of us dealing with the pandemic, and I think technology has become front and center as a way to stay engaged in this pandemic, particularly when seniors are being asked to stay home, to stay safe. It really attributes to a higher level of social isolation that they already experienced prior to the pandemic. The pandemic does exacerbate that a lot more. But on a scale of many things, from the most basic, I guess, from the Maslow's hierarchy, food and nutrition is key. In the beginning of the pandemic, our nutrition services team were really hardworking, incredible work, day in, day out, serving up to 5,000 meals a day, delivering home-delivered meals to seniors and adults with disabilities throughout San Francisco, with a team of about 350 staff and volunteer drivers. That's the scale at which folks were needing the basic necessities. And recently, in the last couple of months, we've launched virtual classes. It is a new way to engage seniors, and we are amazed at the resiliency and the adaptability of our seniors to transition, those who choose to adopt the technology and want to utilize and able to utilize technology to access our services. So starting June 22nd, following the city and local health guidelines, we were able to reopen our agency, Self-Help for the Elderly, our essential services, and majority of our programs that do not have to follow very tight social distancing. Programs such as our Adult Day Health Center has not been able to open yet because congregate settings are not allowed at the moment for indoor operations. And our meals are still to go. So in terms of technology issues, accessing virtual services and classes, we have to see technology as a range of tools that we could use. I would start with the telephone. I think that in my experience during the pandemic, the telephone became a very critical piece of technology that seniors who were not able to adopt other technology devices, including smartphones and tablets, perhaps that were handed down to them from their family members, just really relied on the telephone and the television, actually. So when the signal maintenance issues and propagation issues appeared with Sutro Tower in San Francisco, that affects some seniors' ability to stay connected to the news. So we realized that those two basic pieces of technology were critical for them, and more so than in other times. And to not look at them as low tech, but really as a more universally adoptable tech for particularly our seniors who really have multiple barriers in accessing technology tools because of the language barrier that they have. So the learning platforms, such as Zoom, video conferencing, are in English. So for seniors who don't speak English, they really need to learn how to navigate the different functions in another language. And that in itself presents a huge barrier. When they are able to learn how, it takes time and everybody learns at different paces. So having the class be done sort of right now, when you and I are interfacing, it's difficult to gauge the nonverbal signals and cues that they might have otherwise when we are in class, to kind of understand how they might be feeling or reacting to what they're learning, and whether on a meta cognitive level they're able to process. So we would have to overcome that by asking them to look into the camera, and really visually and also verbally tell us more directly how they're doing, if they're understanding. And we would have to devise, more pre and post measurements to understand whether they're able to attain and acquire the information, since we're not able to visually see the rate and level of processing they're able to do, what frustrations they might be experiencing. One of the things that came up is just the spectrum of familiarity with tech, or comfortable, whether the level of comfort with tech. Those who don't adopt tech will not, and those who adopt tech will over time have a high level of trust sometimes in tech and answering questions, even providing personally identifiable information that we ask them to not provide, just to get rid of the error message or the query on the screen, to get rid of the message or to get rid of the box. And so they vacillate from those who don't trust to those who trust implicitly without question, and to be able to understand framework and more abstractly the concept of computers and how they operate. Because without that abstract concept and knowledge, it's difficult for them to memorize all the individual steps it requires to navigate each of the different pieces, programs, platforms, whether it's social media or an app on their phone that they're interfacing, or just the general setting, even if it was in their own language. So, some seniors have low literacy even in their own native languages. So having pictures and diagrams and photos become more and more important in terms of visual teaching aids, to help them have a universal symbol to understand, what that means. And so we develop little cheat sheets for them that have the symbol. The challenge is different operating systems will have different symbols sometimes and different quirks to them. So not having a universal device with a universal language makes, I think, the intricacies of virtual online teaching even more complicated and time consuming. I think on the staffing level, it is much more work and much more intense to teach a virtual class than it would be an in-person class, because it takes more time, I think, to prepare materials in advance, given the limited time, and also the energy that it takes to navigate not just the learning platform, Zoom video conferencing, but also the device that the learner is using to access Zoom. They could be different. So one of the ways that we organize and streamline this more effectively is have classes be by skill level. That helps to minimize the differences in learning levels and expectations for both the learner and the instructor. Another way is by devices. So folks who have 2 devices versus 1 device might be organized differently, or we might reach out to them in advance to get a sense of their familiarity with their own device before joining the class. and having a Zoom orientation in advance so they can learn how to learn virtually, which is a new concept for folks. We use WeChat as a platform. However, there is a current ban by the U.S. Department of Commerce on this, and a temporary court injunction on that, as well as TikTok. So we don't know how that's going to go. And I think by November, in a couple of weeks, we might have some updates to that. And hopefully we can keep that, because really there's no comparable other social media platform other than Sino Weibo, which we've looked into as an alternative that is allowed in both countries, in China and the US. So that is a challenge. In terms of tools for low literacy, I think sometimes even getting on the phone and talking with the senior, or if it is safe to do so, to meet with them. For example, our social services department, when they're unable to deliver virtual services after they've attempted several different strategies and methods, they will schedule an in-person appointment to meet with them and to understand what are some of the barriers that they might be experiencing. Unfortunately, low literacy is quite common with seniors who are of advanced age. And I think sometimes they might not be visual learners, but they might not be learners of one particular style, but if through conversation, you can understand how they learn. Maybe share some of the things that they were able to learn recently to understand their internal process, how they acquire and process information in a format that then we can reiterate and apply through the technology lens.
Okay, good. Well, I mean, Laurie's question was also related to how they're using the technology, which is also reliant on literacy. So with WeChat, for example, is there something in that design from a user-centered perspective that makes it more usable for a broad range of literacy levels, potentially over other platforms or technologies?
Absolutely. In WeChat, there's a message, a verbal message option where you can just leave a verbal message to someone, which if they're not literate in their own language, is the best tool. Does not require any input keyboard style whatsoever. Just press the symbol to record and they can record. It's completely dictation, like audio file format. So
okay, great. So just like with WhatsApp, there's a similar kind of function with that too. Great. And Stephen at CTN just mentioned Line is a good alternative to WeChat. Are you familiar with Line, Line?
I am not familiar with Line, but this is good to know.
Okay, good. Well, thank you so much, Winnie. That was very, very interesting, and glad that you were able to share a lot of the insights from your work and within the community and with your population. So thank you.